Hello everyone. We're going to give you some instructions how to prepare for a final module test on traumatology and orthopaedics. So this test will include some parts. The biggest one is the computer test. So you can earn up to 80 points totally, and 30 points of these 80 points is for your computer test. You have 90 questions. You have limited time, and you can pass this test within 1 hour. So if you want to be prepared for this computer test, you should go to the Moodle site, Traumatology and Orthopaedics, and there is a link, MSI Test Orthopaedics. If you click this link, you go to the part of the Moodle site where all these questions are present, and you can train yourself in a testing mode or in a learning mode. So actually, all these questions are divided in several topics. There are general questions, traumatology. There are questions about upper limb fractures and injuries of spine, injuries of lower limb, some pediatric problems, genetics, infection, local pain syndrome, benign and malignant tumors. Totally, this test contains more than 1,000 questions, so I would like to advise you to prepare for it beforehand. So another part of your model test is a clinical case. You'll be given a virtual patient for a clinical case. We have developed special scheme that you can find again in our Moodle site. If you scroll down for the topic number 6, I think, topic number 7, you have the link where you can download the scheme of case history. So if you click on it, you'll find the PDF file with the case history. So the detailed instructions how to work with this scheme is given in another video, so you can check the channel, as well as some other videos how to describe X-rays and classify fractures and so on. So that's the case history. You can fill it and you can send it back to me for revision. So the next part of your final test is going to be X-ray description. So you will be given an X-ray. That may be an X-ray with a bone or joint pathology. It may be osteoarthritis. It may be a fracture or different locations. So you should describe these X-rays. You should make the diagnosis. Of course, for this, you need to know the bone anatomy, X-ray anatomy, and you should determine the type of fracture, its displacement, and if the surgery was done, you should note about which fixing device was used. So we have another instructions for these, how to describe an X-rays, and I'm going to prepare this for several locations. So as you see here, then you have 3 oral questions, and each of these questions also can give you 10 points. So total you can have 80 points. The list of these test questions is also present in your Moodle site. So if you look at the top of the site, there is a reference book. Click on it, and you have to scroll down. You will scroll down, you will see the list of questions for final test. So here you'll find 138 questions. There's one question will be given for you about general questions in traumatology and orthopaedics, such as classification of fractures, type of stiffness, so problems with healing, types of internal fracture fixation, surgical and surgical methods of treatment, and so on. One question will be given for you about fractures of different locations, and one about other orthopedic pathology, as osteoarthritis, degenerative disc disease, etc. So we'll see, we are trying to be objective, and this is technologies that we will use to evaluate your level of knowledge. So thank you for your attention, and good luck with your final model test.